Okay, let's go. All right, we're going to go through the equipment required for venepuncture today, and then I'll show you how to put a tourniquet on because you won't be using a real tourniquet in your home. So in your packs that you'll get sent home with you, you will have an alcohol swab, a vacutainer with a needle, a blood collection tube, and you'll have a little sticky dot to use in place of a cotton wool ball and some tape, and I'll show you how to attach that to the arm once we've taken the blood and we go through the whole process. You will also get a pair of non-sterile gloves in a large size only, so some of you might find that too large, but that will be what everybody gets. I'm just going to go through quickly how to use each of these, and then you will get a further video on the whole skill in one go. So this is the tourniquet that you will not get, but you will need to find something in your home, such as a shoelace or a necktie. They are good substitutes for a tourniquet. So you need to pop it above the area in the arm. So we usually take the blood from the cubital fossa in this bend here that you can see in this fake arm. So you need to go about 10 to 15 centimeters above. And as you can see, we don't have 10 to 15 centimeters on this fake arm, so you'll have to imagine it. So on a real tourniquet, you can tighten it or you can loosen it by pressing the button. You adjust it how you need to depending on the arm in front of you. And of course, if you're using a necktie or a shoelace, I'd like you to tie it in a bow, but enough pressure that you'll get some engorgement from the veins, so you'll be able to see the veins stick out once it's tightened. So you need to tie it in a bow so it's easily undone, because tourniquets, as you can see, come apart very easily. So make sure you find something that you can use simply in the home to replace the tourniquet. Obviously an alcohol swab will be used to clean the site once you've picked the site, and I'll show you that once we do it. The blood tube will be attached to this vacutainer, and I'll just jump to this last bit, which you will see once I do the full skill, but it is a sticky dot with some padding in it. And once you've taken the blood and released the tourniquet, you may get a little bit of blood coming out, and you need to pop that dot over the puncture site and get the patient to hold for a couple of minutes to make sure no bleeding is coming out, and then it stays on like a band-aid. But as I said, we sometimes use just a little bit of cotton wool and a piece of tape as well, but you'll have this. The last thing I'll need to do is show you how to attach the vacutainer and the needle. So this will be one unit and it is sealed, and you will be required to break the seal for this. You need to pick up your plastic vacutainer, pull this off. There is no sharp on this end, it is the rubber tip. The sharp is under the black end. So you need to pop it through the hole and then tighten it so it's nice and firm. Once you've done this, you will then move to the patient, and I'll show you in the next skill video that you will have a sharp needle under that black cap. This is the part with the bevel pointing up that you insert into the skin. And then once you get blood out, it's as simple as just pushing the blood tube nice and firmly over the rubber tip, and it fits in. The blood will then drain into the tube, and once the tube is full to the line that you need, you can remove the tube, and sometimes you may need to put more than one tube on and collect a lot of blood for different reasons. You can just keep attaching various tubes to the end of that rubber tip. Once you've finished with your collection, you then will release the tourniquet as shown and then remove it. This then goes as a whole into a sharps container and you drop it in. Obviously we don't want you to do this in the home because we need you to reuse it.